Hello everyone, my name is Ashley Tovar and my presentation today will be on exercise and type 2 diabetes. Type 2 diabetes mellitus can lead to irreversible physiological damage. It can negatively impact many body systems, including damage to the nervous, renal, and cardiovascular systems. 21 million people were diagnosed with diabetes as of 2012. In addition to this, an estimated 8.1 million were undiagnosed. The financial impact of diabetes through direct medical costs is estimated to be $176 billion, with an additional indirect cost from disability and work loss being estimated at $69 billion, meaning the cost could range up to $245 billion each year in the US. Not only is this a growing health concern, but it's a financial issue as well. Current treatment options include prescription medications and weight management through diet and exercise. However, exercise is the most effective treatment for preventing and managing type 2 diabetes. To explain how type 2 diabetes is related to increased weight, I have this lovely little picture. Increased waist circumference increases the amount of visceral adipose tissue. This leads to increases in fatty acids in the blood. In response, the liver releases glucose and triglycerides to be circulated through the blood. The pancreas then responds by increasing insulin output. Excessive insulin secretion leads to insulin resistance in the peripheral tissues, reduces the uptake of glucose, and increases hepatic glucose production, resulting in increased blood glucose or hyperglycemia. This can lead to prediabetes, which is defined as a fasting blood glucose between 1 and 125 milligrams per deciliter, or diabetes, which is associated with a fasting blood glucose above 125 milligrams per deciliter. Another diagnosing factor that you may see would be an A1C or glycosylated hemoglobin. This assesses the average blood glucose over the course of a few months. Diabetes is characterized by an A1C greater than 6.5%. Unlike type 1 diabetes, which results from autoimmune destruction of the beta cells, type 2 diabetes results from decreased sensitivity to insulin in receptor cells. This is due to the oversecretion of insulin by the pancreas. This is also why type 2 diabetes is not typically treated with insulin, as we may see with type 1. Type 2 diabetics produce too much insulin, whereas type 1 patients do not produce enough. Prolonged hyperglycemia can also lead to damage of the microvessels. This affects many different body systems. This damage can be permanent and lead to issues such as nephropathy or renal damage. Diabetes has actually been seen to be the primary underlying cause of kidney disease, contributing to 44% of newly diagnosed renal cases. Prolonged elevated blood glucose may also lead to peripheral neuropathy caused by damage through demyelation of the nerves. This is why many diabetics have to take particular care of their feet. In extreme cases, amputation may be necessary, as 60% of lower limb amputations were originated from diabetes-related complications. Retinopathy is another possible outcome from untreated hypoglycemia. Diabetic retinopathy affects 4.2 million individuals. This can lead to damage to the retina in the eye, causing loss of vision. Type 2 diabetes can also lead to increased risk for developing cardiovascular disease. Some examples of what can develop can include hyperlipidemia or hypertension. Those with ischemic cardiovascular disease in particular had a 17% higher fasting insulin than other cardiovascular diseases. Death risk related to cardiovascular disease is 1.7 times higher in those with diabetes compared to normal glycemic individuals. Most patients can treat their type 2 diabetes through weight management or weight loss. Diet and exercise can provide an increased caloric deficit to reduce weight and reduce the effects leading to hyperglycemia and type 2 diabetes. Prescription drugs such as metformin may be prescribed to lower blood glucose and assist with treatment. Exercise provides a dual benefit in increasing caloric deficit as well as increasing glucose uptake into the cell. This happens with glucose regulation through exercise related to stimulating the GLUT4 transporters in receptacle cells. Insulin stimulates the translocation of GLUT4 transporters to the membrane of the cell. Without the GLUT4 transporters, glucose cannot enter the cell. There's a little diagram here to kind of show what's going on with that, and the green hexagons are representative of the glucose. GLUT4 transporters can also be stimulated by muscle contraction. During 45 to 60 minutes of cycle exercise completed at 60 to 70% VO2 max, a 71% increase in GLUT4 transporters was seen compared to a control. However, other findings have estimated that exercise can increase GLUT4 transporters up to a threefold increase. To assess the impact of treatments, the Diabetes Prevention Program Research Group set out to compare the effectiveness of metformin or exercise on diabetes incidence. 3,234 participants were selected on the basis of having a fasting blood glucose of 95 to 125 milligrams per deciliter and a blood glucose level of 140 to 199 milligrams per deciliter 2 hours following a glucose load of 75 grams. These values would not diagnose them as diabetic, but both are elevated blood glucose values. There were 3 treatment groups. The first group was a metformin group that was given a dose of 850 milligrams twice a day with a standard lifestyle recommendation. This was an annual 20 to 30 minute advisory session on how to reduce weight through activity and exercise. The second group had the same standard lifestyle intervention but was given a placebo prescription 2 times a day. And then there was an intensive lifestyle intervention program. This included advice on incorporating 150 minutes of moderate activity per week with the goal of reducing weight. This was done over the course of 16 classes. Measurements of activity were reported through the modifiable activity questionnaire. The average duration of the study was 2.8 years, with a range of 1.8 to 4.6 years with annual follow-up to assess glucose tolerance, values, and activity. The intensive lifestyle intervention group had the greatest weight loss, with 50% of participants reducing their weight by at least 7% after only 24 weeks. 38% had reduced their body weight by at least 7% at the completion of the trial. The intensive lifestyle intervention group had significantly increased their physical activity in comparison to the other groups. The intensive lifestyle intervention group reduced the incidence of type 2 diabetes by 58% in comparison to the control. There was also a significantly lower incidence of type 2 diabetes in the intensive lifestyle group than there was in the metformin or placebo group. The findings of the study suggested that exercise could provide a significantly greater benefit in reducing diabetes incidence than prescription medications such as metformin. Aerobic and endurance exercise, such as running, swimming, or cycling, can provide many unique benefits. It can help with increasing free fatty acid mobilization, it can decrease lipogenesis, it can promote the oxidation of free fatty acids, or it can contribute to weight control. It does this by increasing caloric expenditure to reduce weight. It can also assist those with type 2 diabetes with decreasing their blood glucose through muscle contraction. To examine the effects of aerobic training on glucose tolerance, a study was completed in Mozambique where 41 male subjects were selected on the basis of having been diagnosed with type 2 diabetes for at least 12 months. All subjects already walked for at least an hour a day as part of their daily activities. They were given additional exercise or control. The treatment groups included a low-intensity exercise, which was 45-minute sessions 3 to 5 times per week on treadmill exercise at 50% of their VO2 peak. The vigorous intensity exercises included 45-minute sessions 3 times a week on a treadmill with 75% VO2 peak. These 2 groups were later combined by the researchers as a single exercising group since they found no significant differences in the results between the 2 groups. Measurements were taken before and after the 12-week treatment, including resting heart rate, fasting blood glucose, an oral glucose tolerance test, A1C, body fat through skin calipers, blood pressure, and VO2 peak. The study found that the exercising group had significantly reduced their fasting blood glucose, A1C, blood glucose following an oral glucose tolerance test, blood pressure, and body fat. Again, there were no significant differences in the exercising groups with varying intensities, so this study suggested that with aerobic exercise, regardless of intensity, it could provide a significant health benefit to type 2 diabetes patients. Resistance training provides similar benefits to what is seen with aerobic exercise. Resistance training increases activity, which can increase the amount of calories burned and therefore increase the caloric deficit, leading to weight loss. Resistance exercise can lead to increased lean muscle mass. Hypertrophy seen from resistance training leads to increases in metabolically active tissue. As a result, this can increase the resting metabolic rate and provide a greater caloric deficit. Increased muscle mass can increase the amount of glucose taken in from contracting muscles. As mentioned, contraction increases the ability for the cell to take in glucose. With more active muscle, the more glucose can be taken into the cell. Resistance training may actually be more beneficial for type 2 diabetes patients than aerobic training alone. To look at the differences in treadmill aerobic training versus resistance training, a study was conducted for 10 weeks with 20 inactive subjects with type 2 diabetes. They were aged 45 to 65 years old, so this was considered to be a group of older adults. Activity was completed for 20 to 30 minutes at 60 to 75% of the participants' maximum heart rate 3 times a week. Treatments included either a treadmill group or a resistance trained group. The resistance trained group did 3 sets of 8 to 10 repetitions of exercises, including knee and hip flexion and extension, shoulder flexion and extension, elbow flexion and extension, and a chest press based on previous publications. The treadmill group did a walking running protocol. Measurements were taken pre and post for waist circumference and A1C. At the completion of the trial, the resistance trained group had a significantly lower A1C than the treadmill group. These findings suggested that the resistance training may be the best form of exercise to reduce blood sugar for patients with type 2 diabetes. The increasing incidence of type 2 diabetes can be reduced through exercise intervention. While resistance training may provide the most significant benefit, all forms of activity can increase caloric expenditure, contributing to weight loss, and provide reductions in blood glucose through increased GLUT4 transport. Exercise may be more beneficial in lowering blood glucose than modern prescription options such as metformin. Increasing physical activity can provide the most significant effect for lowering blood glucose out of the treatments available today. And here are my references.